doctor prescribed the medicine for you. Okay? How many of you have had a nurse or a parent give you the medicine to take? Okay, all right. Okay, now, let me ask you this question. Did you stop with the medicine after your mom gave it to you or your nurse gave it to you? Did you stop and look at the label to make sure it was the right medicine? Okay? A lot of times we really don't do that. We just trust our mom that she's giving us the right dose, right? Or we trust the doctor or the nurse, okay? So that's what we're going to talk about today. There's sometimes that nurses can make errors when we give medicine. And that's not good, of course. And we're going to talk about how to give medicine safely, okay? So I'm going to show you a little video about a medication error, okay? So I'm going to, as far as it's going to play that for us.
It was November 2007, less than 2 weeks after Dennis Quaid's twins were born, when the actor says the nurse caring for them nearly killed them. The babies, Thomas Boone and Zoe Grace, had been readmitted to Cedars-Sinai Hospital in Los Angeles for a staph infection, but the nurse unknowingly gave the twins 1,000 times the recommended dose of the drug heparin, a blood thinner. Quaid and his wife were in the room, but didn't know anything was wrong until the next day, when they found their newborn twins bleeding profusely.
Their now water-thin blood had the real possibility of hemorrhaging through a vein or artery, causing massive brain damage or failure to one of their vital organs.
Quaid says the twins were supposed to receive 10 units of heparin, but instead got the adult dosage of 10,000 units, a massive overdose that turned their blood thin as water. How could this happen? Quaid says both the pediatric dose and the adult dose of heparin have similar labels. For the next 41 hours, doctors scrambled to save his children.
At one point, as the doctors tried to clamp a bleeding wound in the remnant of T-Boone's umbilical cord, blood spurted 6 feet across the room and splattered on the wall.
It was the most frightening night of his life. They'd worked so hard to have children. First, trouble conceiving, then miscarriages, and now this.
Our babies could have died that night.
3 other babies did die in Indianapolis a year before. Just like the Quaids, the 6 infants in that case were given adult doses of heparin. Half of them died.
Pretty serious, right? Those little babies could have died because they got the wrong amount of medicine. And medication errors happen every day, unfortunately. Okay? Every day, one patient in the hospital dies from an error. Okay? That could be the wrong medicine or the wrong dose, like in that story. Okay? About 1.3 million people are injured every year. It's a lot. Okay? So as nurses, we have a responsibility to give medications safely. And so there are certain things that we have to do in order to make sure that we give safely. And so we're going to talk about those things today. We're going to talk about something called the 6 rights. Okay? We're going to talk about how to read a medication label, and we're going to talk about how to give a medication. Okay? And then we're going to demonstrate that on our patients using some skills. The right route. What do we say a route was? The way that you're going to give it. So we've got to make sure that our patient can take it that way. What if they're in a coma? Can they, you know what a coma is? Yeah. They can't respond to us, right? So can we put something in their mouth and make them swallow it? No. They could choke, right? Because they can't swallow. So we have to make sure our patient can take the medicine the way the doctor has ordered it, okay? So we also have to check the label and make sure that they can get it that way. The right time is the 5th right. So we have to make sure that they're getting it at the right time. If the doctor orders it, give it every morning. We can't give it at nighttime, right? So we have to make sure we're giving it at the right time. And then the 6th right is the right documentation. So we have to document after we give it. So I've given Muhammad his Tylenol. I have to go back as a nurse and I have to make sure that I write down, I gave it to him at 9:02 and he took it by mouth and he had 102 temperature. And so now I have to make sure that I follow up with that and make sure that the fever goes down. Okay, so those are all things involved with documentation. Okay, so when we look at a label, there are three main parts we want to look at, okay? The first is the name of the drug. What is it pointing to? Ibuprofen, okay? That's the name of the drug. The second thing we want to look at is the dose of the drug. How much is in each pill? 200 milligrams, good. So that's the dose of the drug. And then the form of the drug, that means how is it, what's in the bottle? Okay, so what's in the bottle?
500 tablets.
So a tablet. The tablet is the form of the drug. Okay, it could be liquid, like we talked about earlier. Could be a capsule, which is one that has two different parts and you can open it up. Okay, so those are forms of drugs. So let's look at what the label says.
It says 200.
Okay.
So I have to take 2, so it can be 400.
Very good. Okay, so I know you can do that math in your head really quickly, right? But I want you to write it down. So go ahead and write it. How would you do that? What was the formula?
D over H.
D over H. What is D for?
The 400 that we need.
Or the
Yes,
prescribed.
the prescribed amount, what the doctor says they need. So write down 400. And then the H stands for what?
What you have.
What you have in your hand. So that's how much? What does the model say? 200. Okay. 2. Okay, very good. So we always have to double check. I know we can do these things in our head really quickly, but a nurse always has to double check. And if you're still not sure, you get another nurse to check it. Okay? So go ahead and open the bottle. Push and turn. Okay, so how many are here? 2. Or she has gloves on, so we're okay to touch all the pills, okay? Your copy. Okay, alright, so we check the label again against the order, okay? That's our third check, right? What's next?
Read your patient, ask, check the medication order against the medication label again before putting it over.
Okay, we did that one.
Greet your patient, ask the patient to state his or her name and date of birth and verifying ID.
Okay, one, come over here. I want you to do that part, okay? So you're gonna greet your patient.
Good morning. Hi, good morning. May I have your name and your date of birth?
Okay, and she says, Pancha Garza, my date of birth is 7/29/65.
Wait. Yeah.
Is that right?
It is.
Okay, so now what do we do?
Tell your patient what medication you will be giving and ask for patient's allergy.
We're gonna be giving you ibuprofen. Do you have any allergies?
And she says, no.
She says no. Okay.
Wash your hands and put on gloves.
You wash your hands and you put on gloves.
Okay,
Help your patient into a sitting position.
all right, so, well, she's already sitting up, right?
Yeah, she's sitting
Okay,
Provide patient education on medication to be given, including uses and side effects. The vital signs if necessary.
okay. So why are we giving this to her? What were the uses?
The uses are for
Mild pain, fever, and migraine.
our information.
Okay, so she said she had a headache, all right? So is that considered mild pain?
Yeah.
Okay, so she has a headache, so you tell her why she's getting it.
Okay, you're going to be getting ibuprofen because you have a headache.
Okay, and what are some side effects that she needs to watch out
Some
for?
side effects are vomiting, and a rash.
Okay.
I know how to pronounce
Vomiting,
Okay,
rashes,
that's fine.
diarrhea,
Headache,
more headaches.
okay, very good, all right. Okay, so then you tell her, if you experience any of these, what she needs to do? She needs to call you. Very good. Okay, so what's next?
And then administer medication to your patient. Make sure there is no difficulty.
Okay, so who's gonna give it? Yeah, go ahead. Finish your statement. Yeah, so just pretend, okay, just taking the pills, and then the water. Always give water. Let's review real quick. What are the 6 rights? Right, raise your hand. Right what?
Ask patients.
Okay, so the right patient, so you've got to ask the patient's name.
Right drug.
Right drug, so how do we know?
You check the label 3 times.
Check the label 3 times, very good. Yes?
Right dose.
Right dose, and how do we know that?
The label.
The label and the order, very good. And so what if it doesn't match?
You don't give it.
Something's wrong. Okay, if the dose doesn't match, then we might need to do a calculation. How many of you had to do a calculation? Okay, a couple of you did, right? Okay. What's another right? That's 3.
Route.
Right, route, what does that mean?
The way you give it to them.
The way you give it to them, that they're getting it correctly, they can take a pill, okay? What's another one? Right time, what does that mean?
Like daily or
How often do you give it, okay? Is it in the morning, is it at night, okay? And then the last one? Documentation, okay, so read me your documentation.
We gave 40 milligrams to Bob Smith, P.O.
40 milligrams of what?
Oh, Lasix.
Ah, you have to write that down, okay?
Flexigarza was given ibuprofen at 9:25 a.m. on March 22nd, 400 milligrams PO every 4 hours. Ms. Garza was informed about the use and side effects of this drug.
Awesome, very good. Very good. Okay, anybody else? Wanna read me theirs? Same thing. I did the same, right? Okay, so very good. So you gotta remember the 6 rights. What are the parts of the medication label?
As patient's name and check ID band. As patient's name and check ID band.
There's 3 parts on the label that we really want to pay attention to. What are they? The name,
expiration date.
And the type
Expiration.
the form, okay? So is it a pill, is it a liquid, okay? That's for a label. Now what about the 4 parts of a medication order? When a doctor writes an order, you're looking for 4 things. The name,
The date of birth.
The way it's
gonna be
the route, the dose, and the frequency. Okay, very good, very good.
one pint.
Okay, just write.
I think it's that one.
Okay.
Too late.
What? What'd you do?
One out.
All right, the frogs and the wolves.
You learn.
Come on.
Oh, that's a cup. No, wait. No. No, that's 2 cups. It's 2 cups. It's like 4 ounces. Because 1 cup is 8 ounces. No, that's technical or something.
Where are the wolves?
100 grams.
Yeah.
Oh, it's
You think 1 ounce was 1 gram?
No, we got it right.
this one.
Man, no, we're in the lead.
I know.
3 tablespoons.
Yeah.
Oh, that's the.
It was the one
Is it on the cup? Isn't it this one? That's a good.
No, it's 1 cup.
That's just 8 ounces.
No, it's 1 cup. Yeah, 1 cup.
1 cup.
Are you sure? 1 cup?
Wait.
30
There's no one.
1 cup, 8 ounces.
Is it in a pound? No.
It's either 1
I think it's
ounce
right route.
a milliliter. 30 milliliters is 1 ounce. 16 ounces. That's 2 cups. No, that's a point.
It's not
No, she has ounces. Oh, yeah, that's what counts. I have one. Oh, yeah.
16 ounces.
Okay, you have to go.
Go.
Yes! 3 extra points.
I was about to.
Yeah, we won.
No,
3 extra